Properly fitting diabetic footwear starts with the use of the Brannock device. Now I'd like to go over fitting several different patients with different foot types in order to properly fit them with that footwear. Measuring with the Brannock device first starts with properly positioning the patient. By doing that, we have the patient take a few steps in place, so please do that right now. And by doing that, that gets them in the most natural position. Thank you. Now we'll raise their patient's foot up and we're going to put their right heel all the way back in the right heel of the Brannock device. First measurement, as indicated on the shoe fitting form, is going to be the heel to the longest toe. In that particular case, we're looking at the yellow indication. Because she is a woman, it's going to be yellow. The first indication, first mark heel to the longest toe is a 9. The next one is the heel to the ball, also known as the metatarsal phalangeal joint. And that measurement is going to be a 9 as well. Line 3 is a midpoint of 1 and 2. The midpoint in this particular case would be a 9 since the first two were 9. Finally, we check for width using that midpoint measurement. I just apply gentle pressure on the little toe of the patient, and then we slide the sliding bar over just till it barely touches the patient's foot. From there, we follow the 9 straight down, and she is in the yellow, so we'd indicate her as a 9 wide. We are not finished here. Of course, we have to do the left foot as well, so have the patient raise their foot. And we'll try the Brannock device on that side as well. Again, making sure the heel is all the way back. Really, this little sliding bar should actually match up pretty well. There shouldn't be a large gap between here and the patient's foot. First measurement, heel to the longest toe is a 9. Second measurement is heel to the metatarsal phalangeal joint, which I actually find in this particular case is a 9.5. Again, remember always that you're reading the numbers facing you. So using that midpoint measurement, which would be a 9.5, a 9 to a 9.5, midpoint of the measurement, it would be a 9.5 as well. Push down the little toe, 9.5, follow that straight down, and she's a wide as well. Ask the patient to sit down, so please have a seat. And from that point, answer the questions as it asks. Does this patient have a high instep or an internal brace? In both cases, I would say no. In fact, as you saw that patient when she stood up, she has a very flat arch in that particular case. No ankle instability, a mild bunion on each foot there, and no hammer toes that were visible. So we would possibly consider with the mild bunion, possibly a Lycra style shoe. So to try on the shoes, we'd actually do some what's called trial fittings. The trial fittings will attempt to try on a pair of shoes, and the one that I got off the display rack was this one, which is the Patty Black. So we'll have the patient slip on this particular style, this shoe first. And again, I like to don and doff the patient's shoes for them, again to simulate or to show them what a properly fit, laced up or Velcro style shoe should feel like. Using the shoe horn as well. One comes in every box of shoes that Dr. Comfort offers. So, as we lace those up, again, the good snug fit, then you have the patient stand up once again. You can have the patient walk around and observing the patient's overall fit, but once the patient is standing still with feet shoulder width apart, we're going to check the widest part of the shoe should be at the widest part of that patient's foot. So in that particular case, I squeeze right there and it actually seems to match up pretty well. And the length, we're looking for anywhere from 3/8 to a 1/2 inch. My thumbnail happens to be a 1/2 inch, and I actually find with that overall length as well as the width there and overall fitting snugly in the heel, that actually seems to fit this patient particularly well. And this happens to be a 9.5. So you could have a seat again. This patient wasn't interested in this particular shoe. They were actually interested in getting another style. So obviously we tried that one on, and if the patient wanted to order another pair of shoes, what we do in that case is order the shoes that they had requested. In this case, it would be the Betsy in the burgundy color. To don those shoes for the patient as well after we've ordered them. We get the patient's shoes on. In this particular case, however, we didn't get the 9 wide. We got the 9 medium in this case, just how this shoe actually fits. This shoe fits actually just a little bit roomier in the toe box than the other shoes. So we'll have the patient stand up in this particular case with this shoe, and again we'll try this on. By looking at this, I would highly recommend this patient actually consider another style shoe, just because of the fleshy instep in the top here, the top of her foot, it might actually start to cut a little circulation off. Not to mention this patient has a very flat arch. This is not providing the support that this patient needs. So in reality, what I would do for this particular patient would strongly advise to get the first pair of shoes we've got, or some of the other styles that would provide support as well as stability in the shoes. And that concludes this particular patient's fitting. For the second patient, what we'll be doing in this particular case is he'll be a gentleman, and this gentleman, same technique, we'll have the patient walk in place again, get them in the most natural position for their feet, thank you, and then have the patient raise up, right heel all the way back. And again, I always start with the right heel just because that's what the shoe fitting form actually starts with. So looking for the heel to the longest toe. In this particular case, we're reading the blue numbers, always the numbers facing you. I push the gentleman's toe down just a little bit, and he's going to be right at the 9 line for the gentleman. Okay, so first right foot, heel to toe is going to be 9. Second indication is the heel to the MTPJ, or the ball of the foot. So he doesn't have a very prominent arch or bunion in this particular case, so I can actually find it with my thumb. I found it right there, right in the center, and that's where I'll line up the sliding bar. In this particular case, he's a 9.5, because again, I'm reading the lines facing me. So line 1, heel to toe, is a 9. Line 2 is a 9.5. Then we come to line 3, again, which is the midpoint to 1 and 2. What that really means is we're going to be taking the larger of the two, if there's just a half a size difference between the two, or if it's a full size difference, a 10 to an 11, we'll go up to a 10.5, because again, we're splitting the difference. So line 3, we'll take 9.5, since that was the larger of the two, and then we'll check the width using that midpoint measurement. Midpoint measurement, again, apply a gentle pressure on the little toe of the patient, slide the sliding bar right over, we'll follow the 9.5 straight down. He's actually a 9.5 medium. Next we go to the left foot, have the patient walk in place once again. Properly position the Brannock device in the patient's heel. And I actually see in this particular case, as I noted before, there's that gap there, so we have to reposition that Brannock device just a little bit so it's properly fitted right there, so it's going to lock into place. So first measurement, heel to the longest toe, which is a 9 as well. Again, always measure both feet because you never know which foot is going to be larger. Next measurement is the 9. We're looking at this heel to ball measurement is going to be a 9.5 as well. So again, a 9 and a 9.5 for line 3, which will be the midpoint, will be a 9.5 as well. Then we'll find the arch line, the width. So we take the 9.5. In this case, he's just at that 9.5 medium wide width. So I'm going to put a medium plus. You could also put close to wide on the side there as well. Next, we'll have the patient take a seat. Now we'll actually do some what's called trial fittings after we look at the additional questions we have. Does the patient have a high instep or internal brace? In that case, no is the answer. Ankle instability, based on the prescription that we received, there are no ankle instability issues and no hammered toes or bunions for this patient, so no other considerations should be taken for this particular shoe. So for this patient, he did measure a 9.5 medium. However, our display rack happens to have a 9.5 wide for him to try on. So what we'll do in this particular case is have him try on the 9.5 wide. My assumption in this case is that the shoes are going to fit a little bit too roomy for him because again, he measured at a medium. So have him try on this one as well. Have the patient stand up for you. Again, you can have them walk around. As I check this, it does feel a little bit roomy, a little extra space in the shoes. So as far as the length goes, adequate length, we're looking for, again, 3/8 to a half an inch. So have the patient take a seat once more. In this case, what we can do with that display rack is just to what's called simulate a medium fit, is remove that in-layer insert that's actually in there and replace it with a blue filler. This spacer is going to, again, simulate what a medium is going to feel like for this patient. So we'll slip that shoe, that filler in there. Have the patient, again, stand. Again, you can try on both if you'd like. In this particular case, I think it actually fits a little bit better for the patient, and the patient actually agrees. A lot of times, though, the patient may even, because this is a diabetic shoe with extra depth, they might actually state that the shoe still feels roomy and large. But remember that 80% of the population is actually wearing an incorrect size shoe, so we want to make sure that we're getting them in the proper shoes. So, have the patient sit down once again. This is not the style that this patient wanted, so what we'll do is have the patient select the shoe. This gentleman has selected the Eric in the bark color. In this case, a 9.5 medium is really what he had measured, so that's what we're going to go with in this particular case. And again, consideration of the sock or hosiery is actually very important. This is actually a Dr. Comfort sock on, so as long as the patient is going to continue to wear that particular sock and this fits comfortably, then that's what the size the patient should go with. So again, help the patient don and doff the shoes. Proper fitting here. And once we've laced up the style that the patient has chosen, we'll have him stand up once again. again, have the patient walk around, check for the overall fit. Again, the widest part of the shoe should also be the widest part of the foot. And then of course checking for the overall depth. Again, looking for 3/8 to 1/2 inch, which we've successfully found with this particular pair of shoes. So this gentleman will be taking those shoes home today with him. Now we've actually fit this patient with the Brannock device outside of the camera just to focus in on some other fitting issues that we might want to focus on in this particular segment. If I'll have the patient stand up in this particular case, I've actually determined her length to be a 9.5 wide, mainly because of her arch length was actually a little bit longer than her overall length. By looking at this also, her second toe is longer than her first, known as a Morton's toe, which actually does pose a small problem as far as fitting, just making sure that we're fitting the longest toe, not always the first toe. You can also see this patient has a very low arch, so a good arch supportive shoe would actually be the best for this patient, or ultimately a proper fitting shoe is going to benefit this patient. So if you'd have a seat for me. Again, I've determined that a 9.5 wide would best fit this patient, so I've gotten a 9.5 wide. In this case it's the Lindsay White for this patient to try on, and this will assist us to let us know obviously if the 9.5 wide would be the best fit for this particular patient. They do have a pair of Dr. Comfort bamboo socks on, which is a little bit normal as far as the thickness goes for socks. So that's gonna help us determine what shoe we'll get for the patient as well, and the difference in the width. So we'll have this patient again, we're gonna don these shoes on. Again, simulating good, snug, comfortable fit, and then have the patient stand up. From here, we can actually see that the shoes are a little bit too wide. We can actually feel that by all that extra material again. We had noticed that before, and as far as the length goes, it seems like we're way too long in that particular fit. Now, again, remembering that shoe size and foot size are two different things when we're measuring, this was just our starting point to find out that a 9.5 was entirely too long. And again, remember her second toe was longer, so that's where I'm trying to feel at the end of the shoe. So even by looking at the overall, from the side even, you can actually see that there's plenty of room in the heel, and this is a lace-up style shoe, so this obviously indicates that this shoe is way too large. So have the patient take a seat. And what's nice is Dr. Comfort has what's called a quick reference guide. Our quick reference guides look like this, and these quick reference guides will guide us in what style and color each of our shoes actually the patient can select from. In this case, the patient has chosen one of our shoes. In this case, it's the Flute in the Lycra, the black Lycra. So we'll have the patient slip these off. So the 9.5 wide was too large for the patient. So knowing that this is going to be a more open top style, what we'll do for this patient is we're going to try on the 9 wide. I'm sorry, we went down a half a size because that was just too large. So let's try on the 9 wide to see what that looks like on the patient's foot. So as we apply, put that shoe on, what I'm going to do is have the patient stand up just so you could notice one thing about this particular shoe. As we notice this, the widest part of her foot happens to be forward of where the widest part of the shoe is. The idea with fitting is to make sure that the widest part of her foot and the widest part of the shoe are matched up. So in this case, a 9 wide is much too short because they're not matching up the break point and the ball of the foot. So what we'll have her do is also try in a 9.5 medium to see how this one is going to fit for her. And as we strap that on, we can actually see the widest part is fitting a little bit more snugly in the widest part of the shoe with the widest part of her foot. So in this case, if this patient was interested in this Flute in a black Lycra, we'd actually get her in a 9.5 medium, even though she measured a 9.5 wide. And again, that quick reference guide is helpful if this patient was going to require a narrow, and we've got the European style, narrower tapered toe box on one side and the standard fit on the other side. So again, in this case, we see that she measured differently than what we actually get for the order of shoes. Measuring this particular patient, we can see we have a little bit higher arch, just to see how they're going to fit a little bit differently as we measure with the Brannock device. So starting with the right foot again, have the patient walk in place, just take a few steps in place if you would. Again, just to get them in the natural position, so lift the patient's foot up, right heel and the right heel of the Brannock device. Then we're going to take the first measurement, which is the heel to the longest toe. In this case, we're looking straight down over the patient's toe, and it's going to be a 9. The next measurement is the heel to the ball, or heel to the metatarsal phalangeal joint, and we again have a 9 as well. So the first two numbers will be 9 for the heel to toe, heel to ball would be 9 as well, and a midpoint would also be 9. Using that 9 midpoint calculation, we'll find that the patient 9 straight down is going to be a 9 medium for this patient. Okay. Going over to the left foot, again, have the patient walk in place. Place the patient's foot down. As we look over this one, we're actually noticing that this patient has an 8.5 heel to the longest toe in that case. So left foot, heel to toe is 8.5. Heel to the metatarsal phalangeal joint right there, going to match up, and that's going to be a 9 in that case. So using this midpoint measurement of those two is actually going to be a 9. To use that 9 to find the patient's going to be a 9 medium. Okay, you can have a seat. As we've determined that the patient's going to get a 9 medium, tried on some shoes, and we've determined that she actually really likes the Paradise in the black. So what we'll do is have the patient try this Paradise on. We've got it on her right foot, so we'll have her slip that particular shoe on. Now, noticing again the patient's socks in this case, probably not going to be, or possibly going to be, the socks that the patient will be wearing with the shoe. If that's the case, we just have to obviously observe if that's going to be an adequate room to allow ample toe space as well as width. So I'll also at the same time have the patient try on a 9 narrow on the left foot, because again these are an open top style shoe, and see how these are going to fit differently. Again, communicating with the patient to find out which style socks or hosiery the patient will be wearing is very important, so if you wouldn't mind standing up for me. In this case, we first check length, heel to the longest toe. We've got adequate length in there. Got adequate length in both of them, which is good because they're both a 9. And then as far as the overall width, it looks like that medium on the right foot there does allow a little extra room. The narrow, possibly a little bit cramped there, but this is a very close call. And again, this is where proper communication with the patient, the hosiery that patient will be wearing is so vitally important. Obviously, if they're wearing a very thin pantyhose or something like that, we possibly want to go with the narrow. If it's a medium, we might want to use the medium, and possibly even use a blue filler in there to accommodate the space inside the shoe. So that concludes this patient's fitting.